you have a physical or mental disability that is severe and your condition limits your activities of daily living, and your medical and/or mental impairment has lasted or is expected to last for at least 12 months, and your doctor agrees with this assessment, then you should apply for disability, either Social Security and/or SSI benefits. Some irrelevant factors include the following. Social Security has a strict definition of disability that ignores many real-life aspects of the job market, including difficulty finding a job, thinking that no one will hire you with your conditions, believing you could not pass a job-related physical or job-required physical, or even knowing that the pay you would receive for the work that you could do is too little to live on. All of these really important real-world considerations simply do not matter to the Social Security Administration when they evaluate your claim for disability. Social Security does not look at whether or not you can do the job that you did before. Social Security looks at whether or not you can do any jobs available in the national economy, whether or not those jobs are close to where you live or not. They are looking at whether or not you can do any jobs in the national economy. So when we prepare your case, keep in mind that we are trying to show the federal government that you are unable to do any jobs, not just the jobs that you did before. Proof from doctors are very important. Medical evidence is crucial. Just as soldiers would not go into battle without ammunition, we cannot go into the courtroom without medical evidence. As the case with many legal claims, what counts in disability evaluations is what we can prove. If no medical records exist to support your claim of disability, you are very unlikely to be successful. Social Security figures that if your medical condition is severe enough to keep you from working, then it should be justified by doctor visits, tests, diagnosis, and treatment. Failure to follow treatment is another huge downfall of many claimants. Social Security expects you to try to get better. That means doing what your doctor orders and prescribes. If you do not believe that your doctor's recommendations and treatments will help, then be sure that your doctor documents the treatment's odds of success or failure. In other words, tell your doctor that you are having problems and/or side effects with the treatment that he or she is prescribing for you. If the medications are causing side effects, be sure to let your doctor know. That is extremely important when we're in court, because one of the biggest things that the judges want to know is that you are compliant with the treatment that the doctor orders. The next thing is keep good records. Conversely, if you do follow your doctor's prescribed treatment, document your efforts. Without records, you are unlikely to remember the date of every doctor visit, lab test, medication taken, procedure, and therapy received. Obtain the business cards of every doctor you see and keep a file of them. Save your pill bottles, keep notes of your pain and other medical events. Keep journals. Keep journals for your migraines, keep blood pressure journals, keep journals to document your blood sugars, keep seizure records. These are all very, very important when you go to court. These are clear documentations of the events and the problems that you're having. It will also be very helpful for you when you visit your doctor. Social Security does not expect you to be an expert on medical conditions. Even if you are, Social Security would rather learn about impairments from your doctor and your medical records. What Social Security wants to receive from you are details about your symptoms. For example, how severe is your pain? Is it constant? Is it intermittent? What aggravates your pain? What relieves it? What reduces it? Do you suffer from shortness of breath, fatigue? No one knows your symptoms better than you. Do your best to explain them in detail without exaggerating or minimizing them. Do not omit or gloss over any lesser conditions just because you have one severe condition and several minor ones. Remember, we're looking at a big picture. We're looking at all of your conditions. We're looking at how those conditions impact you. We're also looking at the medications that you take to treat those conditions and the side effects of those medications. It's a big picture. And if we're missing several pieces of the puzzle of this big picture, then it's not giving the judge a very clear picture of what's going on. We have a very small window of time to paint this picture for the judge, so we want to use that time to the best of our ability. Physical restrictions. What can you do? What can you not do? Is it hard to sit for long periods of time? Can you stand and walk for long periods of time? Do you have to use a handheld assistive device? Is it hard to balance? Is it hard to lift and carry when you use your handheld assistive device? What about bending, kneeling, crouching, crawling, manipulating objects with your hands, handling, fingering, feeling? Do you have numbness and tingling in your hands when you use your handheld assistive device? Is it hard to carry objects? Those things are very, very important. Social Security Disability is a functional program. They will focus on your limitations rather than your diagnosis. Do you do things differently? Have you had to adjust the way that you live to accommodate your new limitations based on your diagnosis? Those are all very important, so you need to think about that when you get ready to testify. The effect of symptoms and restrictions. How does your medical condition affect your activities of daily living? Tell Social Security about the impact on your personal care, hygiene, dressing, bathing, your errands, your housework, driving, shopping, cleaning, social functioning, hobbies, sports, interaction with friends and family. From a psychological standpoint, is it hard to get out of bed some days? Are there days that you can't get out of bed at all? Are there a couple of days a week that you don't feel like taking a bath? Do you have to do your housework intermittently? Do you do things for a couple minutes and then take a break? Are there days that you simply don't want to be around others as far as social functioning? Are you in so much pain that you don't want to be around other people? Maybe things that you used to love to do in terms of sports and hobbies, you find that you can't do those things anymore. Those are very important when you're focusing on symptoms and restrictions. Final point, consistency, accuracy, and honesty. Contradictions, errors, memory lapses, and discrepancies all work to erode your credibility, and nothing will sink your claim faster than questions about your truthfulness. I encourage you to be completely and totally honest during your testimony and when you are completing your application for Social Security Disability.